sharing examples of how healthcare organizations are utilizing technology, data, and expertise to manage aspects of supply chain is important in our ever-shifting environment. Adaptability is necessary, and the pandemic has escalated demands to quickly shift to the next normal. Our team has seen and supported many healthcare organizations who have faced challenges in mitigating supply chain disruptions, access to real-time data, and pressures with cost containment. So today, we will highlight some of these challenges and how collaboration with Aptitude and our strategic supplier partnerships has led to success in supply chain cost reduction through optimal data transparency and execution.
So IHN is a network of 26 hospitals located in the Midwest and the Northeast. The hospitals are not all the same size or have the same needs, but have acknowledged that working together is really what brings them success. We all recognize that hospital margins are tight, and with our new COVID environment, members are looking for new opportunities to really realize some savings. IHN has evolved and has realized that the focus really needs to be in PPI. And to do so, we have become strategic with our priorities to be able to grow our business. To be successful, we've had to engage our physicians and create physician-led committees in partnerships with our subject matter experts.
So how did we land on the approach that we used for trauma with the IHN? As Karina stated, we were really looking to engage physicians at a deeper level when working with these large PPI categories, and we started with trauma. What we know when working with one facility or a single healthcare system, it's difficult to gain consensus many times from the physicians. With IHN, as Karina stated, we were tasked with working with 26 individual facilities, and the question is really, how do we engage and get consensus among all of these hospitals and all of these physicians? Without physician support, we know it's very hard to drive down pricing, and it's nearly impossible to move market share to one or a few suppliers, which would also help with driving down costs. Although we have had support from senior leadership, really since the inception of IHN at these facilities, engaging physicians at a category level was really a newer concept for IHN. We created a physician advisory council for each specific initiative, which included a physician specialist in that category from each member site. We also created a PPI charter, which really guides our entire process. The charter was readily accepted by the administration and physicians within the IHN. So once we have a physician champion from each facility, we set up a series of 3 one-hour Zoom meetings over the course of the initiative. Meeting 1 consists of reviewing current spend and market share for the category, discussing potential savings targets based on internal and external benchmarking. We use market intelligence and other considerations. We then gather physician input and discuss a strategy to move forward. Most importantly, though, we're really looking for physician support for the initiative and for the strategy prior to moving forward. And then meetings 2 and 3 are held to discuss additional feedback, take a look at the RFP results, a new strategy if needed for continued negotiations, and then finally vendor awards and plans for implementation and training. Specifically with trauma, although cost was a major factor, we did also consider things like consignment versus ownership, quality of products, and breadth of portfolio. Some of the key factors we took into consideration when looking at different options with trauma was, number 1, we'd seen somewhat of a market shift across the country from supplier to supplier, and hospitals are looking at other options than owning all the inventory up front. Owning all the inventory is really a large burden for these hospitals. There are options to consign everything depending on the supplier you choose. 2, there's a burning platform today to make cost reductions in some of these high dollar areas like PPI, specifically in trauma. And 3, being able to move 26 facilities in one direction is very difficult. But with the success we had with trauma, it really set IHN up for future success in related categories like total joints, especially since we're working with some of the same suppliers over and over again in different categories.
The aptitude platform delivered value throughout every step of the process for IHN, from developing the strategy, determining the value of the bids, to contracting and implementation. Aptitude was alongside IHN for each phase. Starting with developing the strategy with the Physician Advisory Council that Kelly spoke of, the spend data and market share that the platform was able to provide was used to show the current state of the category, not only at the group level, but also at the individual member level. This level of detail provided that physician insight into what was or maybe was not what was happening within their organizations. At times, this prepared them for conversations that may need to occur. After the RFP was released and the bids came back, the flexibility that scenario modeling or purchase planning allowed for was tremendous. With ease, the platform gave us a clear picture of what the value was at both the dual source level and the highly committed tier level. This allowed for the Physician Advisory Council to see a true picture of what the value looked like for both the group as a whole, as well as their own individual facility. Moving into the contracting phase, we were able to decrease the contract cycle time. By utilizing an active supplier, the contracting terms and conditions had already been negotiated, which allowed for us to fully execute this agreement 2 months ahead of a supplier that wasn't active in the platform. This allowed for the IHN member organizations and the supplier to start capturing the value and not spend time going back and forth negotiating those contract terms. Currently, IHN is working through the implementation phase of the trauma initiative. The platform is playing an integral role in this phase and is giving data insights to assist in deeper level conversations between IHN and the supplier with regards to the conversions that are underway and also those that have yet to start.
Our relationship with our suppliers is improving. We hold regular calls with them during this implementation process, and they definitely feel and see the support from our team. I think the transparency really allows just more direct conversations as we work through the category, and the data presented in aptitude with these active suppliers gives us a single source of truth. They're able to see our market share and commitment trends to find better ways to engage with not only the members, but the suppliers. Whereas the non-active suppliers really require additional steps without this real-time data that we get, it really delays the implementation, which then impacts, of course, the savings that members can realize. We will continue to use this aptitude data to engage with not only suppliers, but members. It really helps us implement and manage our contract compliance and build upon our PPI strategy.
Rush University Health System is a leading academic health system located in Chicago in the greater Chicago area. They're well known for their clinical research, and they've been an innovator in healthcare for over 180 years. They cover all service lines from cardiovascular to orthopedics, et cetera. They have 3 main hospital sites. They have Rush University Medical Center, Rush Copley, and Rush Oak Park. Initially, we were working on the peripheral vascular service line in the fall of 2019, and we were analyzing data for the project and really gaining momentum when COVID-19 hit. And of course, COVID-19 had a huge impact on all cardiovascular service lines. I believe in the spring of 2020, most health systems saw a decrease of about 65% in the cardiovascular service line elective procedures. However, the need for these procedures was still there, so the work could not stop. We just had to find a way to do it differently. They really needed resources, so a team that could perform the heavy lift. They needed expertise to provide guidance on managing the project process and management of the bid process and all of the various product line categories that go with it. And they also needed it done very quickly.
The aptitude platform delivered value by supporting Rush's request to utilize their validated spin file for their RFP snapshot. And based on aptitude subject matter expert strategy and recommendation, custom RFPs were created in the platform at the subcategory level for balloons and stents, drug-coated balloons, and accessories. With the uploaded supplier bid files, the platform offered real-time conversion analytics, which streamlined Rush's ability to determine savings and implementation strategies for a dual source 80% market share award for balloons and stents and drug-coated balloons. Aptitude subject matter experts utilized this data to support Rush's engagement with the physicians around various conversion scenarios and saving impacts, which promoted efficiencies in the decision-making process. And with Aptitude's pre-negotiated terms and conditions, which supported speed to value in contracting with both suppliers awarded in the drug-coated balloons and stents, plus additional active suppliers who awarded access contracts for the accessories RFP. This, in turn, was a win-win for both supplier and Rush at the same time.
We realized that Rush would need a holistic approach, and due to their decreased bandwidth with COVID-19 hitting at that time, that's when we really partnered and we reached out to Aptitude. We knew that Aptitude could manage the spend categories within peripheral vascular. They could provide the speed to value that Rush was looking for. And by utilizing that Aptitude platform and with the vendors that were within that platform, they had built, meaning Aptitude had built good relationships with those suppliers. And that was something that we could take advantage of. And that speed to value was really what Rush needed. And that's where Aptitude really became a huge part of our project.